Hello. Today we will be discussing the eRinse Brite, the new internal bleaching and whitening solution, a product by Dr. Amy Dukoff.
Let's begin with a bit of background about Dr. Amy Dukoff. She is an endodontist with her own private practice and CEO and founder of eRinse Dental Inc. Alongside her education, she is a member of the First District Dental Society, the American Association of Endodontists, and other dental organizations. She also has patent products including the eRinse White and eRinse Brite and the eRinse Smile.
Let's proceed by discussing a bit of the new product, the eRinse Brite. It lightens, whitens, and bleaches the dentin. It is peroxide and acid-free. There is a neutral, slightly basic pH. It aids in removing the stains and organic debris. It also improves the appearance of the inside of the tooth and aids in cleaning the pulpal chamber, making RCT easier. It is also proudly made in the USA. Here you see an image of the eRinse Brite. Let us elaborate on a few of the bullet points that we have just discussed. First, it makes internal bleaching much easier. With an in-office visit, same-day visit, short treatment time, not sealed in the access cavity for the patient to return to complete treatment procedure, and its simple procedural steps.
Here, you will see a dark lateral incisor. The internal bleaching of the lateral incisor is conducted in an in-office visit, same-day treatment, at the time of RCT. It also provides an improved appearance and a wow result. Next, we will discuss a list of topics, including the internal whitening and bleaching importance for aesthetics and RCT, the ADA code, its use in endodontics, directions for use, regulations in EU and AAPD, pragmatic trials, benefits, and finally, some contact information. As we proceed, you will see the different topics and where the studies were conducted. Let us begin with the internal bleaching of teeth is very predictable, quick, simple, and cheap, and it is conservative of tooth structure, according to the below. Why does Dr. Amy Dukoff believe is it important to clean and whiten the inside of the tooth during a root canal treatment? She has found that it has done the following: improves the transillumination through the tooth, improves visibility within the pulpal chamber and the tooth. It also removes tissue in the dentin and enamel that may be infected or a source for reinfection. It removes organic tissue that is stained and may cause darkening of the tooth. It improves visibility of the pulpal wall and floor and calcifications. It also improves visibility of the dentinal wall and identifying the tooth's slant. Next, you will find information about the ADA code regarding internal bleaching code. Sample insurances that allow payment reimbursement for D9974 are as follows. Next, we will explore the clear identification of the floor-wall junction is the single most important aspect of the accessing phase of the endodontic treatment, from the source below. Floor-wall junction is needed for locating pulpal orifices. As per Krasner and Rankau's laws of color change, symmetry, and location seen below. As for the law of concentricity, the law of color change shows that the floor is darker than the walls. With the law of symmetry, orifices are in the perpendicular line across the floor. Color changes are visible. There's a dark gray floor, orifices are located on the floor, and differentiation of structures. Here you will see the directions of use in the start of the RCT procedure for internal whitening and bleaching for endodontics. The steps you will see here on the right of your screen. Please remember to repeat the above steps as needed. There are also a few additional steps that we must remember, seen here on your screen. There are also directions for use in cases after RCT. These include remove, cover and seal, and follow. Here, you will see a saturated cotton pellet soaked with e-rinse Brite solution. A note and recommendation would be that the cotton pellet size varies with the size of the target area's surface area. And here, you will see a cotton plier carrying the e-rinse Brite to the target surface. Place the cotton pellet in tooth with positive pressure. Rub the target surface and squeeze out the solution on the desired target surfaces. Cosmetic regulations do apply. The FDA classifies e-rinse Brite as a cosmetic as per their definition, which states, articles intended to be rubbed, poured, sprinkled, or sprayed on, introduced into, or otherwise applied to the human body for cleansing, beautifying, promoting, attractiveness, or altering the appearance. The e-rinse Brite is within EU regulation. Tooth whitening products containing or releasing between 0.1% and 6% hydrogen peroxide can only be sold to dental practitioners. Under the American Academy of Pediatric Dentistry, the oral health policy statement includes minimizing exposure to hydrogen peroxide, using the lowest concentration of hydrogen peroxide is preferred, the use of hydrogen peroxide in heating any mixture of sodium perborate is not recommended, and the use of sodium perborate and water for non-vital bleaching. Next, you will see some pragmatic trials for tooth number 25, 10, 8, and 14. Tooth number 25 depicts dark discoloration. Tooth number 10 depicts a black tooth with history of trauma. Next, you will see an in-office treatment, one visit RCT with internal bleaching applications. A calcified central is seen here, sheared off clinical crown at gum line, and a receded canal system. And here, we see an RCT on tooth number 8 that is completed. A mesial buccal canal orifice with a blocked orifice on tooth number 14 is seen here. And the RCC completed on tooth number 14. There are several benefits to this process, including a great-looking tooth, increased enjoyment at work, improved productivity, and increased referrals. Some of the benefits the doctor has gained in endodontics
were having an improved visibility of pulpal chamber, having the appearance of the pulp chamber improve, an aid in identifying and removing calcifications, an aid in finding canal orifices easier, having an aid in improving the illumination of the pulp chamber. Keep in mind there are other eRinse products, including the eRinse White, the eRinse Smile, and the eRinse Smile and Shine. Once again, the eRinse Brite is for internal bleaching, for tooth whitening, and for endodontics. To contact Dr. Amy Dukoff, you will find her information here. To order the eRinse Brite, please contact one of the listings seen here. A special thanks to the following for their contributions. This concludes our presentation. The following will be a list of references. Thank you for listening.